Hello viewers and welcome back to your guide to COVID-19. In this video, we'll be discussing some strange side effects and symptoms of COVID-19. I found these really strange and I think you will too. Let's get into it.
Although the devastation that COVID-19 causes is well known, what's less well known are the strange symptoms caused by the virus's infection and why they occur. A notable strange symptom is the loss of taste and smell. Because COVID-19 is a respiratory center disease and the oral and nasal cavities are linked to the respiratory system, these areas are more susceptible to COVID damage. Research from Harvard suggests that COVID-19 impedes the function of supporting olfactory cells, meaning something similar possibly happens to the tongue. Diarrhea and vomiting are also common complaints of those infected with COVID-19, despite it being a respiratory disease. This is most likely because the virus attacks the cells in the gastrointestinal tract, but it could also be a byproduct of the body fighting back, attempting to flush out the virus by expelling waste from both ends. COVID toes are a symptom of COVID-19 where a patient's toes and, occasionally, hands are swollen and discolored, similar to chilblains. Although this topic is still being researched, a likely reason for COVID toes is inflammation caused by the body's immune response to the virus. COVID-19 strange symptoms can also be neurological, resulting in the confusion and dizziness that COVID patients often have. These problems could be a result of the fatigue that the body is undergoing from fighting the disease, but it could also be a result of the virus crossing the blood-brain barrier, harming blood vessels and triggering immune response. Blood clots are also strange COVID symptoms that can result in heart attacks and strokes. A likely reason for this symptom is the body's immune system being overactive due to fighting the disease, resulting in more clotting factors in the blood.
COVID-19 can also have some crazy, unexpected side effects on our health. The first side effect observed on COVID-19 patients is memory problems. Memory problems are caused in COVID-19 patients due to the lack of oxygen in the brain, which can lead to brain damage. Moreover, long-term COVID-19 stays can cause PTSD, or post-traumatic stress disorder, the side effect of which is memory problems. Finally, the COVID-19 virus is known to cause brain inflammation, which can also potentially lead to memory problems. The second side effect experienced by COVID-19 patients is depression and anxiety, which can be caused by isolation from others for a long period of time. Depression can also be stimulated by the excessive stress that COVID-19 patients have over recovery and treatment. As mentioned before, the virus's interference with the nervous system can also result in depression and anxiety. Another side effect experienced by COVID-19 patients is hair loss. It is important to note that the hair loss is actually just hair shedding. We know that fevers can be caused by the virus, and a common effect of fevers is that more hairs transition to the shedding phase. Hair loss can also be caused by the stress COVID-19 patients often experience.
We hope that you enjoyed this video and were able to learn something new about some of the side effects and symptoms of COVID-19 that are not usually typical of another virus. But then again, COVID-19 isn't your typical everyday virus. If you want to watch more videos like this, please be sure to like and subscribe. Also check out our Twitter and Instagram links posted in the description. Thank you and see you next time!